Thank you, Choi, for introduction for me. Yes, he said I'm a neurologist, but today I talk about the body CT or opportunistic screening. Yes, I have some COI of this presentation shown in this slide. Yes, today my talk is the introduction of the opportunistic screening. And last two, we introduced our team research about the automatic detection of spine compression fracture and automatic segmentation of intercostal muscle. Yeah, this is a commentary of the last year in radiology, the opportunistic screening. Yes, opportunistic means that quantitative finding at imaging can be used for population health purpose, including risk profiling and pre-symptomatic detection of disease. AI algorithm will be critical step the widespread implementation of opportunistic CT screening, providing objective, reproducible, and efficient automation. Maybe some problem is how to, we radiologist or reference provider and patient know how to use this. And there are some problems for the reimbursement of these data. Yes, this is the body CT of the patient of the acute abdominal pain. And in Japan, the many cases of the abdominal pain get the chest and the body CT, chest and abdominal CT. And we need to read the chest. And in this case, we also check is there any cause of the pain. But we get this body CT. In that CT, we get some information of the visceral subcutaneous fat. It's related to the metabolic syndrome. Also, skeletal muscle is related to sarcopenia, or liver fat is fatty liver, or arterial vascular calculation is a cerebral vascular disease, and bone mineral density is related to osteoporosis. And today my talk will be about the spine. It also includes the spines, and we can detect the complex fracture in this screening or some clinical indication CT. We get more information in this CT. Yes, I talk about first the compression fracture. Yes, this is also some case. The 70 years old male drug-induced interstitial pneumonia post-tracheotomy. And follow-up, he has some dyspnea, we get the CT. Yeah, this is a chest and body CT, and do you find any abnormality in this CT? Yes, maybe it might be difficult. But this is also scout. And in this case, they are a little difficult. But we make this sagittal image. It's very easy we found the compression fracture L3. Yes, everyone says we always see the axial image. And it's very difficult to compress the spine, only the axial image. But very easy to reconstruct this sagittal image. But in our clinical routines, maybe we usually don't make MPR like the sagittal or coronal. Yeah, we only read the axial CT. There are no abnormality. We always finish the cases. This is the Japanese population data. Why the compression fracture is important? The main reason why people are certified as needing nursing care or assistance under the long-term care insurance system in Japan. In this data, 12.5% of the main cause of needing the nursing care was fracture and falls. yes, 1/8 of the fracture. This is another data. This shows that 35% of fracture patients who visit the medical institution have a pre-existing fracture. This means that diagnosis of the asymptomatic fracture is important to prevent the new fracture. This is the ACE guideline to the osteoporosis treatment. In these algorithm, there are some the big points: the fragile fracture exists or not, or prior fracture is a very important point to select the treatment. We need to know there are some of the previous fracture. Yes, we collaborate the Fujifilm AI technologies, and maybe last session they have some presentation. The more detail is maybe present there, and Fujifilm AI technology is there are 3-step technologies for the medical imaging AI. One is organ segmentation, and second is the computer-aided diagnosis. Third is the workflow streamlines to support the writing the report. Yes, in our hospital we install the Fujifilm scanner packs. We always use this is very useful, and they automatic vertebral and rib number recognition functions. Yes, we put the one click, they get this image, and it's very convenient if we found the rib fractures. We need to count is very troublesome for us, but it's very easy to correct the number. Also, the Fuji has a very good segmentation technique. They already have the kidney segmentation or psoas muscle segmentation and get the volume of the each side. Also, they also do the spine segmentation very well. And also for the spines, there are some problems. There are some scoliosis cases. And for their workstation of the Vincent, they have to get the center of the spine and made the curved planar reconstruction. If these are scoliosis cases, we can get the very straight spine image. We develop the automatic spine fracture detection. At first, we do the spine segmentation and for the future point making and to measure the spine height and judge the fracture based on the guideline. There are 3 types of compression fractures. One is wedge fracture. It is anterior height is decreased. Second is biconcave fracture. The center of the body is depressed. And also crash fracture is the loss of the whole of the height of the vertebral body. In this algorithm, we create a model of exact future point in vertebral body edge. In the input image, we set the center of the vertebral and 6 points of the edge of the spine is determined. After we set this future point, we measure the height of the anterior and the center and the posterior. In this future, it's very clearly that if there are large osteophytes exist, we correctly set the feature point. Yes, we training about 100 cases in a hospital and affiliate hospital, and 1.1 ratio of the complexion fracture or not. Or also we select the more difficult case, osteoporosis and scoliosis cases. And one radiologist create teaching data. But this is now final result of our spine fracture cases. About the recall rate is of the 0.9% and specificity of the 0.88%. Results for each fracture type. Biconcave fracture is 0.8 and wedge fracture is 0.89. And fracture is a little difficult. The recall is 0.6. And this is the same case of the case 1. Yes, yeah, we can see the sagittal reconstruction image. Yeah, we can get the L3 is a complex fracture. Finally, we get some result like this red is site of the compression fracture. For the summary one, we developed the automatic spine fracture detection algorithm using body CT in collaboration with Film Corporation. This algorithm demonstrates high diagnostic accuracy, and opportunistic CT screening could help identify patients at high risk of fracture in the future. Maybe I think this algorithm will be commercially available within this year. I heard from the Fujifilm. Next, I will talk about the segmentation of the intercostal muscle. Yes, recently that using the CT, there are some of the segmentation method is developed by using AI. This is some of the paper of the Radiology AI. This is a total segmentator. It's very easily segment the 104 anatomic structure by CT image. And this is also the, you can get the archives. But in this segmentator, the muscle is all limited, and the lipopsoas and the gluteus muscles. And we are very interested in the intercostal muscle, maybe which is very related to the respiratory functions. And we are collaborate with the Nara Institute of the Science of the Technologies. We developed this intercostal muscle segmentation. This is presented last year RSNA. Yes, in this study population, we get 129 patients with a pre- and post-operative assessment of the lung cancer. And for the external validation is applied for the 16 cases of the another institutions. This is our algorithm in segmentation for the training data set. At first, the 10 case is manually segmented by radiologist 1. And in this 10 case, we developed the automatic segmentation algorithm with the Bayesian unit and applied 100 cases. And for the result, we select the 10 case in order to decrease segmentation uncertainty case. And radiologist 1 correct these 10 uncertain cases. After that, the algorithm is an improvement using these cases that we get the B result. We repeat 3 times to select these 10 uncertain cases. The algorithm is improved. Finally, I added some case of the contrast enhanced cases. And finally, we get the full automatic segmentation of the Bayesian unit for 60 cases based on the F result. And this is the result of some muscle segmentations. You can find there are clearly segment these intercostal muscle. And in this region, there are some of the vascular bundles the upper side, and this is a muscle. In this region, they are clearly separate the muscle and vascular region. This region is not so good, but this region we can clearly separate. Yes, this is a result of the muscle mass component volume and mean CT value of each muscle by ground truth evaluated by the radiologist and automatic AI measurement. Yes, there are very good correlation between AI measurement and the ground truth by radiologist for both muscle volume and the mean CT value of the muscle. Yes, this total intermuscular muscle volume was correlated positively with height and body weight. It is very reasonable for the body and the weight is increased, and the muscle is also increased. And also, this total intermuscular volume was correlated positively with respiratory functions for the forced vital capacities and the forced equilibrium volume of the 1 second. This is correlate with the muscle volume of the respiratory functions. Yes, next step, we applied these results to the lung disease patient for the chronic interstitial pneumonia. The patient number is small, only the 36 patient is chronic IP, 10 is the idiopathic pulmonary fibrosis, 17 is the connective tissue disease related IP, 9 is the IP with other etiologies. We also applied our algorithm. This is a case of the pulmonary fibrosis, IPF. This case is a very hard case, and the respiratory function is very decreased. Also, the volume of the intercostal muscle is decreased. And this is another case of the IPF. But this patient maintains their pulmonary function, and also intercostal muscle volume is maintained. Yes, this is an association of intercostal volume with pulmonary function test parameters in IPF, chronic interstitial pneumonia patient. And this is a percent DLCO and percent FBC. It also correlate to the muscular volume. This slide shows the volume of the 1 to 7 bilateral intercostal muscle, and this is a strong braceless IP patient and weak braceless IP patient. The number is small. The strong braceless IP patient reduce their muscle volume compared to weak braceless IP. Now, in this is not statistically significant, but the P is 0.07. And I think if you increase the patient number, I think it's a very significantly different. In summary, too, we developed an automatic algorithm for segmentation intercostal muscle using body CT in collaboration with the NIST. The algorithm quantified total intercostal muscle volume with correlate with body habitus and several parameters of pulmonary function test. Additionally, total intercostal muscle volume shows a correlation with pulmonary function test outcome in patients with chronic interstitial pneumonia. Maybe many doctors say pulmonary function test is a very patient dependent. You try to, it's a very patient dependent. Also maybe very difficult to the heavy dyspnea patient. I think this is a very future to evaluate the pulmonary function using the CT data. Yes, in conclusion, opportunistic CT screening capitalizes comprehensive imaging data from body scan, which can traditionally be underutilized due to its prospective lack of the relevance of specific clinical indications. This incidental imaging data offers substantial potential to enhance patient wellness and prevention strategies through risk profiling and the early detection of the significant disease. In this presentation, we demonstrated algorithm from the detection of the spinal fracture and segmentation intercostal muscle, which AI can accurately quantify. Radiologists must develop effective strategy to manage this considerable data volume efficiently. Yes, we thank our collaborator and thank you for your attention.